Hello, my name is Dr. Shane Watt. I'm the treating chiropractic physician at the Neurobolic Health Center. It's located in South Jordan, Utah. You can reach me by calling me at 801-495-4444, or you can reach me at email at wattisupdoc@yahoo.com. Today this is about thyroid. I want you to understand there is help out there. Unfortunately, for the vast majority of people, there is no help. They've tried different things with their medical doctors and practitioners and haven't had really any success. I want you to know there is success that can be yours, but we've got to have a different approach. What makes my approach different? Why does my approach work? Well, what I want to do is I'm going to share with you 6 different individuals and their brief experience in my office.
How soon after you first started the program did you start seeing changes?
I'd say within the first month, I noticed my energy level was 100 times what it ever was, even with multiple drinks of caffeine in a day.
And that was kind of a staple for you, right?
Oh yeah.
Because just so she works as a vet tech, but she works it's a 24-hour veterinary clinic. So sometimes she's there late at night, early mornings, different, like all kinds of weird hours, so it kind of messes her up. So you work a lot of night shifts. Overall, from what you saw in the program, why would this approach, do you think, would be beneficial for those who are questioning? Because that's who watches these videos, is people that are like on the fence, not sure, they really don't know whether they can trust somebody, those kinds of things. What would you say about that?
I would say, it worked. You can listen to 100 people say it worked, and I just did a short program, and I saw results. The energy level was better, my memory was better.
Came in. What were the biggest issues that you had going on? What were the problems? The reason why you said, "Hey, I need to go get help"?
Well, I felt a lot of fatigue. And that was kind of the motivation to bring this all about, and some memory loss as well.
Okay, and some of the other health issues that you were having, you were having some diabetes issues. You knew you had some thyroid issues, right? Those had already been medically diagnosed, right?
Correct.
Now, one of the things that was really cool, about 2 months into about 2.5 months into our program, you came in, and what was the thing you were excited to tell me about?
Well, my primary care physician had indicated that I was free from diabetes.
So his primary doctor had done some more blood work, and through the testing, basically said, "Hey, I can't even diagnose you as diabetic anymore." Now, to be fair, Steve had already lost several, about 50 pounds before he came into our office.
Oh yeah.
So
he
had already started doing some stuff and things like that, but his doctor hadn't been able to clear him of that. And then with some of the dietary things that we did with changes and some of the gut cleanses and things of that nature, it really helped with the blood sugar issue, and that was really cool. The other thing, a bit ago, he also came in and said, "I don't think I have the fatigue issue anymore," which is always nice. How old are you, Steve?
Pardon?
How old are you?
67.
67. Now, but he's not retired. He's still working. He still works. He goes to work every day, 9 to 5 kind of job type thing. So, he was feeling fatigued and felt like he had a lot of the energy and things of that nature. What were the results that you experienced?
Like I said, I haven't had the stomach problems at all, and the fatigue was doing great. I wasn't having that problem for months. It felt so much better. I was exercising again regularly and just motivated to do stuff. I guess that's not something I mentioned before, but I didn't really notice the lack of motivation to do stuff until it started getting better and I started picking up hobbies again and things like that.
So that's awesome, because those are things you don't really think about.
Yeah.
But those are the things that are life changers.
You just think it's because you're tired.
Right.
And then you don't have time to do stuff, but it's really just lack of motivation. I don't know.
So what was the best thing about the whole program?
Well, I'm 18 weeks pregnant.
Sweet. So I'm going to show the little belly. It's little, not too big yet. So one of her biggest things that she wanted to do was she hadn't been able to get pregnant.
Yeah.
And so we have had another successful person that wanted to get pregnant, that was able to get pregnant. This is the little baby. It is March 12th today, and she was born 3 days ago, March 9th.
Yeah.
March 9th. So this was the recipient of the thyroid program, why we have this little angel here.
So, I don't know, a month ago or so, she was breached, so we came in and Dr. Watt did the adjustment, and she flipped head down within 2 hours of being adjusted.
And you felt her turn,
oh,
right?
Yeah, it was very obvious.
So it's a technique called the Webster technique, and we did that with her.
I would say that if you think you've got a thyroid problem and the doctor keeps giving you pills to get over it, or if your energy level is down, or you're losing hair, you're gaining weight, those kind of things, you need to get in your mind that you need to do some kind of regimen to take care of it.
Depression was probably one of the biggest things that I suffered with.
Mm-hmm.
And
how quick were you able to see the fatigue start to change into more energy and the depression start to subside?
I think probably about a month to maybe a month and a half is when I started feeling more energy, and when I started to realize,
hey, I'm able to do more stuff around the house without being so tired and things like that.
Yeah, and the depression was the biggest one. My husband was really happy with that. He's like, she's a totally different person. That's what he says to people all the time. I am a different person than I was a few months
That's
ago.
awesome. In fact, and I was just telling her this, I think one of the best days is, we always have these little highs as a doctor, and one of the best ones was the statement. It was just a simple statement, I'm not sad anymore.
Yeah.
And that's always...
Yeah, I don't feel sad anymore, and I really felt like I was walking around with the dark cloud over my head. So that is huge, and I know a lot of people walk around with the dark cloud.
Yeah,
So.
yeah, that's for sure. What would you tell people that are wanted to, looking into this to decide whether they should do it or not?
I think that it really would help you, and to try it, because without your health, life's really hard. And so make the sacrifices that you need to make. I mean, if you're spending money in something that has no value, your health has a lot of, it is extremely valuable to be able to get the quality of life that you want.
What were the biggest results that you saw from doing the program?
I have a lot more energy, and
this is now, she's still talking, this is 2.5 years after.
Yeah, absolutely. This is, the whole process is, it's really a lifestyle change. And if you can make those changes, and I'm not saying it's easy in the beginning, it can be a real challenge, particularly when you're going through the testing and and changing up everything that you're eating. It's hard. But it's definitely worth it.
There's always people out there searching, so they're watching this video going, how do I know whether that's the place for me? What were some of the positive things you had about our office that you would be able to recommend us for someone?
There was no pressure. You gave me the information and then let me make the decision. There was no pressure to do it initially. And you really worked with me to make the changes, always checking in, seeing what was working and what wasn't, what were my challenges.
I want to thank those patients who allowed me to video their testimonial of what we've done for them with their thyroid care. I appreciate their hard work and effort, because it does take a lot of time and effort, and I want to thank them for that. What does make us different, though? Why did those patients have success when they weren't able to get success any other way? This is going to be just a really brief analysis, but I do want you to look into the other YouTube videos that we have, and we'll talk to you about those in just a second. But the concept and idea is this. Everything starts in the brain. The brain sends hormone to the pituitary gland, to the thyroid gland. That then needs to be converted in the gut, in the liver, in order to get into the cell. There's over 10 metabolic steps that occur from the brain to the cell. The problem is standard medicine is only looking at 2 of those. They're not looking at all the different processes that can happen. The other problem is they're not looking at different things that can cause issues to those processes and allowing those functions to work properly. The problem is that mainstream medicine does this. They look at the thyroid gland and, oh, your thyroid's not working, we're going to give you some Synthroid, levothyroxine, something like that. There's so much more to it. There's so many different players in that. Is it autoimmune? gallbladder, liver function, brain chemistry, adrenal glands, hormones, blood sugar, digestion, brain function, diet. All those things play a major role. And we address all of those because they all work in harmony to help with the thyroid gland. Now, what else makes us different? We do intense testing. When you get your normal blood work done, they usually take 2 to 3 vials of blood work. When we do it, we take between 12 and 14. It's done at a lab outside my office. Why? You want me to be the best detective I can be in order to get you the results that you are looking for. And that's what makes things different. We do gut and digestion. We have to look at that. If you don't clear out the gut, you are never going to get well. And probably, if you really think about it, most of you have gut and digestion problems. Food sensitivities, a major player. It's major. A lot of things can be helped drastically with just eliminating certain things out of your diet. Is it an autoimmune condition? What's turning that autoimmune condition on? What are the triggers? Blood work, like I said, we talked a little bit about that. Adrenals, hormones. We do, for cycling females, we do a 28-day hormone panel. Have you ever had that done before? No. We want to see the ebbs and flows of what's going on with the hormones. And most women that have thyroid issues do have hormonal issues. We got to check to see if there's bugs and critters, if there's other bacteria, wrong bacteria, fungus, parasites. All those things can be triggers to the issue. And then we also do an intense brain and neurological evaluation. Please watch my additional videos. Thyroid Made Easy Part 1 and Part 2. You can probably see them up here in the right-hand column if you're watching this on YouTube. They should be there. Please watch those. Those go into all the stuff we just discussed. They're about 30 minutes each, so they go into really in-depth analysis on what's going on. Once again, my name is Dr. Shane Watt. My office is the Neurobolic Health Center. It's located in South Jordan, Utah. I hope you've learned something from this, but please watch those other videos. That's where you're going to gain most of your knowledge. But if you're suffering with this condition, or if you know someone who is, please call my office, schedule an appointment to either come in for an evaluation or to come to the seminar that we're offering. I promise you it will be well worth your time and effort. There's too many people that are out there suffering. They don't know where to go. We have answers. We will be able to help you. We'll find out what's going on, and we'll let you know exactly what we can do to help you out. Thank you so much. Please call our office. Have yourself a wonderful day.